Doctors won't say this out loud, but these 5 ugly truths shape how seniors are treated every single day. And the first one sets the tone for everything that follows. Many doctors quietly believe seniors are simply too complicated to deal with. Walk into any clinic and you'll see it. Younger patients get straight, simple conversations. Seniors get quick nods, fast conclusions, and a prescription printed before the full story is even told. Not because doctors dislike older people, but because the modern system trains them to move fast, and seniors don't fit into fast care. Instead of taking the complexity seriously, many default to shortcuts. They focus on one symptom while ignoring the rest. They pick the most likely diagnosis and move on. They prescribe common drugs instead of investigating deeper. This mindset isn't spoken, but it's visible. Seniors get fewer advanced tests, fewer second looks, fewer full evaluations. If something doesn't fit the common pattern, it's dismissed as just aging. That phrase alone has prevented millions of seniors from getting accurate diagnoses. Picture a senior who reports chest pressure, fatigue, and shortness of breath. Instead of running complete imaging, many doctors assume stress, dehydration, or anxiety. Meanwhile, blocked arteries quietly worsen. Or take a senior who reports weakness and dizziness. Instead of investigating circulation, medication interactions, or neurological issues, many doctors simply recommend rest. Rest doesn't fix a failing system. It masks it until the crisis hits. The problem isn't the senior's health, it's the doctor's time limit. Medical visits are short. Seniors need longer visits, more detailed questions, and more careful listening. But in clinics packed with back-to-back appointments, complexity becomes an obstacle instead of a responsibility. Older patients often sense this shift. They're cut off mid-sentence. Their concerns are brushed aside. Their symptoms are minimized. When that happens often enough, seniors begin to doubt themselves. They stop mentioning the smaller issues, not realizing those small issues are early warning signs that could prevent a future emergency. What makes this truth so dangerous is how predictable the consequences are. Misdiagnosis skyrockets. Worsening symptoms get overlooked. Conditions that could be treated early turn into major health events. Seniors end up in the emergency room for problems that should have been caught weeks earlier, simply because a rushed doctor saw complexity as a burden. When a doctor believes a patient is too complicated, it changes the whole tone of the visit. Instead of curiosity, there's impatience. Instead of careful evaluation, there's guesswork. Instead of a plan designed specifically for an older body, there's a quick solution meant to get through the appointment. Seniors deserve better than the fastest path out the door. This truth is not about blaming every doctor. Many want to do better, but the system pressures them to move fast, and seniors require slow, careful medicine. Those two realities collide every single day, and seniors are the ones who pay the price. Your health problems aren't complicated failures. They are the normal result of a long life lived in a human body. They deserve time, attention, and depth. What doctors won't say out loud is that complexity isn't the issue. The clock is, and that silent conflict shapes your care in ways most seniors never realize. Truth number 4. Doctors assume seniors won't follow prescriptions. Here's the second ugly truth doctors rarely admit. Many assume seniors won't follow prescriptions correctly. They expect skipped pills, stopped medications, half doses, forgotten doses, or complete abandonment of the treatment plan. And that assumption quietly changes the level of care older adults receive. Most seniors don't realize how quickly this judgment forms. A doctor sees a long medication list, a history of side effects, or signs of confusion around dosing, and they immediately make a mental note: this patient won't stick with it. Once that label forms, it influences every decision that happens afterward. Instead of prescribing aggressive treatments, doctors choose mild ones. Instead of offering new therapies, they stick to older, simpler options. Instead of adjusting medications carefully, they assume the patient won't follow the plan. Seniors end up with watered-down care, not because the condition requires it, but because the doctor quietly expects failure. This assumption creates a dangerous loop. Many older adults do struggle with prescriptions, not out of laziness or stubbornness, but because the system is stacked against them. Medications interact. Side effects are stronger with age. Directions are unclear. Costs are high. Memory slips. Pill bottles pile up, and most seniors don't want to admit when a medication feels wrong, so they stay silent. Doctors see the silence, not the struggle. They interpret missed doses as non-compliance rather than a sign that the treatment plan needs adjusting. Instead of asking why, they assume the patient didn't care enough to follow through. But seniors care deeply about their health. They just need clarity, patience, and a plan they can actually manage. This truth becomes especially dangerous when medications control critical conditions. Blood pressure pills skipped for a few days can lead to sudden spikes that damage blood vessels. Diabetes medications not taken consistently can cause sugar swings that injure nerves, kidneys, and the heart. Blood thinners missed even once can increase the risk of clots. And yet, instead of strengthening the partnership, the doctor's bias weakens it. There are countless real accounts of seniors who stopped a medication because of dizziness, nausea, or fatigue, side effects that would concern any doctor. But instead of bringing it up, they feared being dismissed. When the doctor later sees the medication didn't work, they assume the disease worsened, not that the senior stopped the drug. So they increase the dose or add another pill, creating a cascade of confusion and risk. This silent misunderstanding breaks trust on both sides. Seniors feel overwhelmed and unheard. Doctors feel frustrated and assume non-compliance. The result is rushed decisions, missed warnings, and care that no longer matches the patient's real needs. The deeper issue is that older bodies process medications differently. What works for a 40-year-old can feel unbearable to a 70-year-old. Seniors need more monitoring, more adjustments, and more conversations, but instead they receive less. The system assumes they won't follow through, so it stops trying as hard. This bias also affects how doctors explain treatment. When they believe a senior won't follow directions, they often shorten explanations, skip details, or rush through warnings. That makes it even harder for seniors to manage their medications safely. It becomes a self-fulfilling cycle. Doctors expect non-compliance, give less guidance, and then see more non-compliance. The truth is simple. Seniors don't need judgment. They need clarity. They need medication plans that fit real life. They need doctors who ask the right questions, look for side effects, and check in before assuming anything. When that happens, adherence improves and outcomes rise. But as long as this quiet bias remains, seniors will continue receiving treatment plans based on assumptions instead of reality. And that bias can turn a manageable condition into a dangerous one. Truth number 3. Doctors believe seniors hide too many symptoms. The third ugly truth cuts deep. Many doctors genuinely believe seniors hide symptoms, minimize pain, or downplay warning signs. They see older patients as people who don't tell the whole story, and that assumption changes how carefully they investigate your health. It starts the moment you sit down. A doctor asks, "How are you feeling today?" Many seniors answer, "I'm fine," even when they're dealing with discomfort, pressure, dizziness, numbness, or pain they've simply learned to live with. Doctors see this pattern so often that they begin expecting it. And once they expect it, they stop digging. They assume you aren't saying everything, but instead of asking more questions, they take shortcuts. They stop trusting your report. They rely only on what they see on the surface, and that's how serious conditions slip through the cracks. Silence is common among seniors for reasons doctors rarely acknowledge. Many older adults don't want to sound like they're complaining. Some don't want to be a burden. Others worry the doctor will brush it off anyway. Many fear being told it's just age, so they stop mentioning symptoms altogether. But doctors don't see the fear. They only see the silence, and they interpret that silence as a habit. This becomes dangerous because aging bodies give quieter clues. A strange pressure in the chest may be early heart trouble. Tingling fingers may point to circulation problems. Dizziness could be a blood pressure issue, medication interaction, or early neurological change. Shortness of breath might be lung disease developing slowly. None of these start with dramatic pain. They start with subtle hints that seniors often ignore. When doctors assume seniors hide symptoms, they adjust their behavior in ways that hurt care. They ask fewer follow-up questions. They perform fewer targeted exams. They investigate less aggressively. They might dismiss mild complaints, assuming there's a deeper problem the patient isn't mentioning. Instead of patience, they default to frustration. The dynamic becomes toxic. Seniors stay quiet because they feel rushed or ignored, and doctors investigate less because they assume seniors stay quiet. Important warning signs go undetected until they turn into emergencies. Consider how many seniors say nothing about nighttime chest pressure, leg swelling, vision changes, or memory lapses, simply because they don't want to worry anyone. That silence costs lives, not because the senior didn't care, but because the system taught them that speaking up doesn't always lead to action. For doctors, this perception becomes a shortcut. If you appear calm and say little, they assume everything is stable. But older adults often normalize pain. They normalize fatigue. They normalize symptoms that should never be ignored. A senior who says, "It's nothing," may be experiencing something serious. A doctor who doesn't ask further questions may miss a life-threatening condition. This belief also affects how doctors interpret vague symptoms. When a younger patient says, "I feel off," doctors investigate aggressively. When a senior says the same thing, doctors often search for a simple explanation or dismiss it as age-related. Not because they don't care, but because they expect incomplete reporting. They assume they aren't getting the full picture, so they rely on the diagnosis that fits fastest. The real cost is delayed care. Hidden symptoms in seniors progress faster because older bodies have less reserve. A small warning today can become a medical crisis in a matter of weeks. When doctors don't ask and seniors don't tell, small clues turn into big emergencies. This truth exposes a painful imbalance. Seniors expect doctors to listen. Doctors expect seniors to stay quiet. And the gap between those expectations is where misdiagnosis, missed signals, and preventable hospital visits occur. The solution isn't loud voices or dramatic complaints. It's clarity. Seniors who bring written notes, mention every symptom, and refuse to downplay discomfort receive better care. Doctors pay more attention when the information is complete. But many seniors don't know they're allowed to be that direct. This unspoken belief that seniors hide too much influences care every day. It narrows the doctor's focus, cuts the visit short, and leaves critical signs unaddressed. Not because seniors want to hide anything, but because the system made them feel like they should. Truth number 2. Doctors think seniors take too much time. Here's the fourth ugly truth every senior needs to hear. In a medical system built on speed, older adults are seen as time-consuming. And that bias changes the care you receive long before the doctor even walks into the room. Most primary care appointments in the United States last around 15 to 18 minutes. That's supposed to cover your history, your symptoms, your medications, the exam, the discussion, the plan, and the paperwork. Younger patients fit neatly into that window. Seniors do not. Older bodies have multiple overlapping conditions. Medications interact. Symptoms are harder to describe. Questions take longer to answer. Stories require context. That's not a flaw. That's normal aging. But the healthcare system treats it like an inconvenience. Doctors feel the pressure of their schedule all day long. When they see a senior on the list, many mentally brace themselves. Not because they don't care, but because they know the clock is stacked against them. That silent frustration shapes the entire appointment before a single word is spoken. You can see it in subtle ways. A doctor interrupts sooner. They finish your sentences. They skip deeper questions. They give quick explanations instead of detailed ones. They redirect you if you try to describe something slowly. They steer the conversation toward one issue, even though you came in with 3. None of this is personal. It's the system's time pressure squeezing both of you, but the result is the same. Seniors leave with half their concerns unaddressed. The tragedy is that older adults require longer visits. Aging bodies don't give simple signals. Chest discomfort could be heart disease, lung problems, a side effect, or even anemia. Fatigue could be thyroid issues, low iron, circulation problems, early infection, or medication overload. Balance problems might come from the inner ear, vision, nerves, blood pressure, or all of them together. Sorting through these layers demands patience, exactly what the system doesn't provide. This time pressure leads to the most dangerous pattern of all: quick fixes, a new pill for a symptom, a referral instead of an explanation, a dismissal instead of investigation. Seniors get good enough for now because the next patient is already waiting. This isn't quality care, it's triage disguised as treatment. Real lives are shaped by these rushed minutes. A senior walks in with swollen ankles and mild breathlessness. A doctor in a hurry sees it as fluid retention, prescribes a water pill and moves on. But if they had 10 more minutes, they might have asked about nighttime breathing, listened longer, or checked for heart failure, a condition that can stay hidden until it becomes life-threatening. Another senior arrives complaining of dizziness. Instead of exploring blood pressure changes, nerve issues, hydration, or medication interactions, the doctor blames aging and sends them home. A preventable fall happens weeks later. Time pressure doesn't just shorten visits, it shrinks curiosity. It reduces follow-up questions. It makes doctors default to the fastest explanation instead of the correct one. And older adults, with more complex bodies, need the correct explanation more than anyone. Time bias also affects preventive care. Younger patients get extra screenings, lifestyle guidance, and long-term planning. Seniors get maintenance. They get reminders to take it easy, not strategies to regain strength or prevent decline. Preventive care takes time, and the system rarely gives it. The hardest part is that many seniors blame themselves. They think they talk too slowly, or ask too many questions, or bring up too many concerns. But the truth is simple. The system wasn't built with older adults in mind, even though older adults use it the most. Doctors won't say this openly, but in a rushed schedule, seniors are viewed as the appointments that run long, an unspoken burden on the calendar. And when a doctor walks into the room already thinking about the clock, your care is decided before the first question is even asked. That doesn't mean seniors should stay quiet. It means the opposite. It means being prepared, being direct, and refusing to let the clock decide the quality of your care. Truth number 1. Age bias is real, and it changes everything. The fifth and ugliest truth is the one no doctor wants to admit out loud. Age bias is real. It's in hospitals, clinics, emergency rooms, and private practices. It influences decisions in a way most seniors never see, but feel the consequences of every year. Age bias doesn't look like open disrespect. It looks like hesitation. It looks like downplayed symptoms. It looks like delays in testing, delays in treatment, and fewer life-saving options being offered. And it's one of the most dangerous forces in senior healthcare. Here's how it plays out. 2 patients walk into the ER with the same symptoms: chest pressure, sweating, and shortness of breath. One is 45, one is 75. The 45-year-old is rushed for imaging, lab tests, and monitoring. The 75-year-old is more likely to be observed, given fluids, or placed in a lower urgency category. Not because the symptoms are different, but because the expectations are. Younger patient, fight aggressively. Older patient, be cautious, wait and see, or it's probably nothing serious. This bias is often wrapped in polite language. Age-appropriate changes, normal for your stage of life, not unusual at your age. Behind those words is a quiet calculation doctors are trained not to talk about. The system views older bodies as higher risk and lower reward. Higher risk because complications are more likely. Lower reward because the expected years gained is smaller than in younger patients. It's cold, it's unfair, and it shapes who gets treatment and how fast. Age bias also affects the willingness to offer advanced procedures. Many seniors never even hear about life-saving options simply because a doctor assumes the patient won't tolerate it, won't want it, or won't live long enough to benefit from it. Yet the reality is clear. Treatments don't stop working at 70, 80, or 90. Arteries still open with stents. Clots still dissolve with medication. Joints still improve with surgery. Cancers still respond to new therapies. The biology doesn't fail. The system's assumptions do. This bias shows up in smaller ways too. A senior says, "I feel different today," and instead of a full evaluation, they get reassurance and a quick discharge. A senior reports numbness in a hand, and it's labeled arthritis before checking circulation or nerve damage. A senior complains of fatigue, and the conversation shifts to mood rather than heart or blood issues. These shortcuts happen because age bias nudges the doctor toward the simplest explanation, even when the real cause is serious. The most painful part is that many seniors internalize this. They start to believe their pain is normal. They stop mentioning small symptoms. They accept rushed answers. They assume fewer options exist. They think decline is automatic. And that silence gives age bias room to grow. Here's the truth every senior needs to hear. Your symptoms matter just as much as anyone else's. Your life is not worth less because you've lived more of it. You deserve full investigations, full explanations, and full access to every option modern medicine offers. Doctors may hesitate, but biology doesn't. Older bodies can recover. Older adults can improve. Older patients can benefit from intervention. The key is making sure the system sees you as someone worth fighting for, because you are. Age bias thrives in silence. It weakens when seniors walk into appointments prepared. It disappears when families ask sharper questions. It collapses when older patients refuse to accept "it's just age" as an answer. The system may not change overnight, but the attitude you bring into the room can shift the entire interaction. If you know someone over 50 who's worried about getting weaker, send them this video. And if you want more science-backed ways to stay strong and independent as you age, hit that red subscribe so you don't miss the next one.